We need to be very precise in what we recommend for these patients to eat. We need to be very dogmatic, if you will, because here's somebody with multiple life-threatening illnesses. And so we need to do everything we can to preserve his survival time, but also enhance his quality of life. Welcome to Montgomery Heart Wellness, and here we are. We have another day of MHW clinical rounds. So what are we presenting today?
Today we have a patient. This is a really great story. We'll call him FW. He is a 63-year-old male. He came here with a really long history of coronary artery disease. So he had a heart attack in 2005 with a stent. He had bypass surgery in 2007 with 3 bypass grafts. He was on an insulin pump for type 2 diabetes. He had hypertension and stage 4 chronic kidney disease. So a lot going on. And he came here because in the last few months, he'd noticed more shortness of breath with his activities, more fatigue. And he was told his ejection fraction, the pumping of the heart, was 20%. So that was very startling and upsetting to him because it had gone down despite all these interventions he'd had.
How long ago was the bypass?
2007.
The stent from the heart attacks in 2005.
Yeah.
Do we know his ejection fraction at that time?
I know it was higher than 20% because his other cardiologist, it's the one who presented to him, your heart's gotten weaker again.
So he got better after the bypass.
Right.
So the bypass did help, which is important to point out. I mean, these things can help, sometimes. But despite that, he started getting worse after a while.
And he was on a lot of medications, over 10 at that time, coming here. And even though he was on all those meds, his A1C was still elevated at 8.4. His lipid panel was still mildly abnormal. As we mentioned, the renal function was really bad as well. And so we wanted to see what else could be done to improve his heart function and his energy. So he started the detox process with us, and he did it for almost 3 months, the raw detox, with time-restricted eating. We got him to start getting comfortable exercising gradually as well. And so very quickly we had to stop the insulin pump because hypoglycemia is very life-threatening. I think it was about 2 or 3 weeks. He really wasn't using that at all.
So from an insulin pump and 2 or 3 weeks off the insulin pump because of the blood sugars. Now you started him on, was that raw detox diet, time restricted eating?
He
wasn't doing all
sauna.
This after the bypass surgery either?
No, and that's a good point. He was never educated how to really change his diet, which we encounter a lot. People just aren't educated after these major events in detail how to change their diet. So therefore the disease is going to continue, and then that's why stents and grafts get occluded and blocked.
I've referred patients for bypass, I've referred patients for stents, and it's not like this is the first recommendation I make. However, if someone has such severe heart disease or any illness, you then need to make a fundamental change in your lifestyle. If he went through all of those efforts and then he's on a lot of medications, that type of person needs to be on a raw detox diet. You need to really up the dosage of lifestyle intervention. The unfortunate thing about our standard way of practicing medicine is, well, heart healthy diet. I remember I was at a recent ACC meeting, I was online and I interjected a question to one of the heart failure experts. I said, well, what dietary recommendation do you make for your heart failure patients other than low sodium? He said, well, heart healthy. What does that mean? I mean, there are fast food places that get an A- rating for the American Heart Association. I'm not trying to criticize the American Heart Association, but the point is we need to be very precise in what we recommend for these patients to eat. We need to be very dogmatic, if you will, because here's somebody with multiple life-threatening illnesses. And so we need to do everything we can to preserve his survival time, but also enhance his quality of life. I just can't overemphasize the fact that he had gone through all these interviews, had a heart attack in '05 and a bypass surgery in '07, and nobody apparently talked to him about what to eat. Maybe they mentioned low sodium heart healthy, but that's not enough. So that's really important. And in fact, we'll talk about this in some other cases, but we've even put a healthy, nutritious restaurant on site. And we have chefs that we work with in detail in terms of making delicious gourmet plant-based foods. That's extremely important.
So in 35 days, he had dropped over 30 pounds. In 43 days, he dropped 35 pounds. He initially was on Ozempic, which nowadays is kind of used sometimes for weight loss even. We took him off of that drug, so he's losing more weight off of that medication because of the lifestyle changes that he was implementing. And his initial ejection fraction with us was actually a little higher, 30%, but in 2 months it went up to 45%. And he was stage 4 chronic kidney disease. And then in that 2 month, that filtration rate of the kidneys, I think it started at 29, it went up to 45. And that was extremely motivating, improved cardiac output, helped the renal function, but just his blood sugar, his lipids, his blood pressure, everything improving because of the things he wasn't putting in his body anymore, and instead replacing that with things that facilitate more cell repair.
Yeah, some of these diabetic weight loss medications can, in rare cases, cause kidney failure. So despite coming off the Ozempic, his weight, he continued to lose weight, probably more than he would have lost staying on the Ozempic. What do you think, Ashley?
I mean, which is a good point. I'm glad you brought that up because right now there's the big trend toward going to GLP-1s for the whole purpose of weight loss. Yeah. Here's a gentleman who was on it and actually had more of an outcome based on lifestyle changes. We hear this, like I said, I mean, the drug is flying off the shelves because of the fact that everyone's on this kick of trying to find this fast solution. There is no fast solution to bad habits. And I think is a good, valid point here. I mean, he did better not being on the drug and still lost more weight just by changing his diet.
So he had some pretty major improvements in a relatively short period of time. He also was in our workout program, so he was working out at the gym. Is that correct?
Yeah, I did do some of those workouts, and that really was, I think, awakening for him because he came to us very inactive and kind of not believing in himself. I think we all noticed a big change in just his personality and his amount of positivity. Kind of looked at things now in more of a way, I can do this, what else can I do, versus I can't do anything, I'm stuck here.
Yeah, that's such an important point, Camille. I mean, getting the patient, empowering them with the confidence and the knowledge to know that they're going to get better, but also giving them the tools to do better. Everybody is responsible for their own health. We talk about health care, this and so on. Each of us are responsible for our own bodies. Now, yes, we need help in the system, etc. But what we try to do is we try to give our patients the right tools to work with so they can become empowered to do the right thing. And it's a beautiful thing that he became empowered mentally and psychologically to say, yeah, I can do this. And when the weight started coming off, the energy started improving, you gave him more encouragement to do it. You gave him a very strict regimen. Raw fruits and vegetables only, time restricted eating, my goodness. Some people say that's too extreme. A lot of my colleagues, oh, that's too extreme. But the extreme part is that it's extremely effective and extremely beneficial. Having your chest cut open and rib bone cracked and under anesthesia, that's pretty extreme too. But that extreme didn't work. Your extreme worked. So you're going to choose one extreme or the other. Choose an extreme that works.
Yeah, I think of more people than most would think are willing to try this because it really helps people feel better faster. And we see all the data and the proof that things are getting better, but they feel physically and mentally better than they have in 20 years. And that's improving their day-to-day quality of life. And he, at 3 months, he lost 63 pounds. The filtration rate of the kidneys, which initially again was 29, went up to 82. So really doing so much better overall.
Let's look at some of the outcomes. And we graphed some of this data. Now, what I did here is that we looked at a combination of his ejection fraction, the LVEF, that's in blue, as you said, started at 30% and then it went up to 45%, which is a pretty significant improvement. RV systolic pressure, that's the amount of pressure on the right side of the heart, that was at about 42 millimeters of mercury, which was a little bit on the high side for right side pressure. That means there's some congestion and increased pressure on the lungs due to the weak heart. And when the heart got stronger, it became less congested, and the pressure on the right side went down to 28, well within normal range. So that's a very important finding. And we know that somebody with heart failure can have liver congestion, in large part due to the pressure on the right side. Blood comes from the veins in the legs through the liver up to the right side of the heart. If there's a lot of pressure on the right side of the heart, it gets congested. That pressure gets delivered back to the liver. So a lot of heart failure patients could then have liver failure as well as kidney failure. So he could potentially have 3 organ systems that are impaired in addition to GI problems and thyroid problems, etc. So the kidney function, as you pointed out, the creatinine went up a little bit, but then came down to 1.03. And as the creatinine, the higher the number, the worse the kidney function. The GFR, which stands for glomerular filtration rate, as you said, was around a 29 to 26. And again, this is someone who had stents, bypass surgeries on how many medications when he came?
Over 10.
Over 10 medications. So he's getting everything medicine had to offer, all the pills, all the procedures, etc. But his body was still failing. It was only after he got an aggressive lifestyle intervention when things started to turn around. If you look at kidney failure in medicine, we think of like 3 areas, right? So there's an area above the kidneys that can cause abnormal kidney function, the area within the kidneys, the kidney itself, and then the area after the kidney. So if someone has obstruction, like if they have kidney stone or something obstructing the flow from urine outside the kidney, it can cause congestion in the kidney. So we call that obstructive. That's usually, fairly easy fixed. You get rid of the kidney stone and get rid of the obstruction, and then the kidney function will turn around if you catch it early enough. So that's called post-renal. Then you have what's called intrarenal. That's disease in the kidney itself. That's due to high blood pressure, high cholesterol, diabetes, etc. The kidney is about 75% of the blood vessels. So if the blood vessels in the kidneys are diseased and plaque-ridden, then you have what's called intrarenal, or disease in the kidney. Then there's what's called prerenal. We talked about it in some other case with dehydration, or you have a weak heart that's not circulating blood to the kidney very well. That's abnormalities before the kidney. Now that oftentimes can be corrected easily if it's dehydration. You hydrate them, the kidney function gets better. Or if you have heart failure, improve the cardiac function or heart function or circulation, the kidney function gets better. So the point I want to make there is that if you go see a doctor and you say, oh, your kidneys are abnormal, you want to ask yourself, is it abnormal because I'm dehydrated, or there's a circulation problem above the kidney, or if you know you have a kidney stone, most people know that. But either prerenal, or starts before the kidney, or intrarenal, sometimes can be hard to differentiate. What I did is I graphed the improvement of circulation. So you have here the ejection fraction is 30%, GFR is around 29, and as ejection fraction went to 45%, GFR went to 45. Now, is that directly correlated? That could be. We do think that some of the kidney function improvement was due to improvement in circulation. Beyond that, I think it's probably related to improvement in function in the kidney itself, due to the nutritional things he was doing, infrared sauna, the exercise, and also better hydration. The diet he was on is a better hydrated diet. So there are multiple factors that are at play here that's helping the kidney function get better. So Camille stopped his insulin pump. The blood sugar went up a little bit. Now these aren't, numbers that'll send you to the emergency room, but they're not as tightly controlled as before. What do we know about tight control of blood sugar versus loose control of blood sugar? Anybody?
Well, there were some studies that in very tight control of blood sugar in heart failure patients, it actually increased their mortality.
And even in non-heart failure patients. You work with endocrinologists. When they did the very tight control, these patients have worse outcomes than loose control. And my take on it was that they were using more medications. And so the tight control, I think, was just excess pharmacology. You mentioned hypoglycemia. That's a problem. You go to the emergency room with low blood sugars too much. All that wasn't as tightly controlled. It's probably a good thing coming off the insulin pump. But notice what happened to the A1C. A1C went down. In our studies, we show when we actually, the group of people who were not diabetics, we did not see a significant change in fasting blood sugar. We saw a significant reduction in hemoglobin A1C in a very short time. In fact, we were able to see a 3.4% reduction, which was statistically significant in just 4 weeks. And this was in a non-diabetic group, so this is a patient who's diabetic. So he had a little over 25% reduction in his hemoglobin A1C. You don't get this very easily with medication. In fact, we stopped his medications and got this. And so he was on insulin pump and Ozempic, and A1C was 8.4. You stop the Ozempic, and what, he goes down to 6. I mean, that's amazing stuff. Very powerful stuff. The bottom line is he made great progress. There's still more work to do. We have other modalities. As I said, we use integrative care, regenerative care. He may be a candidate for ozone therapy, more detox, more sauna, more exercise, and the like. Any other thoughts?
I do have a question. I mean, the original time when he first came in, the first couple weeks diet-wise, was he just eating the standardized American? Was he more meat-driven? Was he more dairy product-driven?
I think it's just more your typical standard American diet.
Okay.
He also was stressed, a lot of things going on with his family.
Okay.
That's the thing, is standard American diet, and somebody probably told me, follow the diabetic diet, or somebody told me eat low sodium. But these things are not very precise. I don't know what that means. It's okay, low sodium, fine, thank you. But, you go and you eat the same old processed hams or whatever, and a low sodium processed ham is probably about as lethal as a high sodium processed ham. So I think we just have to be more precise with our patients. And this clinical presentation is someone who's very, very ill, morbidly obese. And granted, we're not totally out of the woods yet. There's more work to be done. But you can clearly see how this patient's moving in the right direction.
I had experience when I was working in endo. When I used to talk to people all the time about the diabetic diet, people were so fearful of eating fruits, natural food, because they were always taught, low carbs. They just kind of gravitated and put all carbs into the same basket, and then they would just always avoid natural stuff. And I think that's a big misconception. When we were talking about low carbs, we were really talking about the processed sugars. But we tend to just kind of put everything into the same category, and they throw out the blueberries, they throw out the strawberries, all the natural stuff that would be beneficial, reducing inflammation, low glycemic index, and all of this stuff. So I think that's a big problem when it comes to the educational stuff.
I'm glad you pointed that out. Did he eat a lot of fresh fruit?
During the detox, yes.
Smoothies and the like?
Yeah. Beforehand, not really.
So before the detox, he was not eating fruit, but after he was eating smoothies and fruit and all of that
So
stuff.
that's improvement.
Yeah, a huge improvement. So that's a great point. I'm glad you pointed that out. Well, there you have it. We have another interesting case. I hope you enjoyed this as much as we did. Also, I want to mention, if you have any questions about anything we've discussed, please leave it in the chat. We'll have individuals monitoring the chat. We'll go on and try to answer as many of these questions as we can. Also, some of your questions may stimulate topics in the future, so we look forward to hearing your questions and hearing from you. Until next time, take care.